Alcohol and drug abuse has increased dramatically during the coronavirus pandemic.
You must stay at home.
According to the British Liver Trust, their helpline calls have risen more than 500% since lockdown began in March 2020. Despite clubs, bars and pubs being closed for more than 30 weeks, gov.uk have released data that alcohol liver damage related deaths have increased by 21%. Andy from We Are With You came to chat to us about how she and her team help people in need.
Hi, my name's Andy. I'm a support worker for We Are With You in the North East Recovery Hub. Once I've been allocated a client, the first thing I would do is read through their assessment, read through the risk assessment, and then I would pick up the phone, give them a wee call.
Andy is the first stepping stone in the detox process, as the first voice of comfort and assistance to the person in need of support.
Before we get took in as an inpatient, I would be focusing on harm reduction with them. So this maybe be if they're drinking spirits, I would maybe advise them to drink lager or cider. If I would try and encourage them with my support to reduce their alcohol down to a lesser amount, making it a wee bit more kind of easier for them when they go in for detox, because they're not drinking vast amounts of alcohol at this point.
Andy's role is to support the individual throughout the detox process, checking in with them and offering advice and support.
While the client's in for detox, I would normally keep in touch with them, whether that be if it's a home detox, whether that be if it's in a risky house. I would just be phoning with them, checking in with them, even just kind of making sure that they're settled in okay, see if they've got any problems on the ward. We do find sometimes problems can arise in the ward. People may want to walk out, getting out of the detox halfway through, so it's about encouraging them to stay in there, see the detox through, so as then obviously we can continue to work with them when they come out.
We then went to meet with Darren, a nurse in Newlands Clinic specialising in the addiction detox process. Darren takes people through their detoxes, administering their medication and vitamin shots to boost their liver and gut health throughout the process.
Hi, my name's Darren. I'm one of the nurses that works in the North East Addiction Services in Parkhead, and I work in a team that can facilitate detoxes for people who have issues with alcohol and drugs. A big part of the kind of detox process is engaging with the person and making them feel supported, and allowing them to kind of offload everything that's going on with their lives. And a big part of what we do is kind of educating the person on what different kind of routes they can go down in terms of detoxing. We do a kind of initial assessment for people who are wanting to kind of have help or come off of alcohol and drugs. We usually get referrals from like different organisations that are out with the service, like We Are With You. And that's usually kind of put forward to us, and then we invite the person in to the service, and we do a kind of initial assessment, which is like an adult screening form we call it, and within that assessment we kind of probe regarding their alcohol use, basically kind of investigate how much they're using, what maybe triggers they have that make them drink or use the substances. And then from there we kind of work out what's the best plan for the person. We look into their physical and mental health if there's any issues with that. Once that's done, we kind of look more into their kind of social aspects, if they've got support from family, if they've got good support from friends, to kind of work out what's the best plan for them. Because there's obviously so many different detox kind of ways, routes that they can go down. For instance, if the person does have good family support, if they've got young children, things like that, then usually it's more suitable for a kind of home detox. Sometimes it's more kind of chaotic people that are using it a lot more regularly, kind of daily, and their lives are quite chaotic, so they're usually more suitable for kind of in services like Eriskay House, which is like a detox service where the person would go and kind of live for sometimes 1 week, sometimes up to 6 weeks, to basically get a more kind of regimented routine, and these places have support from like psychologists and nurses. Obviously with alcohol, the kind of regimented medications, diazepam for kind of getting people off of alcohol, and obviously it just depends on how much they're using and how regular they're using it. A nurse will come out to the person's house and provide them, say, a kind of a script for a diazepam prescription. The nurses will provide the diazepam tablets just from the pharmacy to save the person having to kind of go back and forth to the pharmacy to get it. They're looking for engagement from the individual. More recently, I've noticed quite a spike in the amount of like alcohol and drug use and people trying to engage with the services, or referrals have certainly increased over lockdown due to obviously isolation. I mean, a lot of people who maybe don't have a lot of family members or support, or maybe did have kind of friends around them at the time before lockdown. Obviously with lockdown occurring, that's all kind of stopped, and a lot of people have been kind of locking themselves away and using a lot more substances or alcohol than they normally would, because they don't have support in place, or they feel quite lonely, or it's one of these things that certainly increased over the time with COVID, and there's been quite a number of people that have been in quite poorly conditions due to their high amounts of alcohol or drug use.
We then travelled to meet with members of a women's group, Renew, based in Colton, to hear their stories.
My name's Carol Ann and I'm an alcoholic. My journey to alcohol was progressive. You know, it didn't happen automatically, it happened over the years. I got to a point where there was no return. I was a mess, I was broken, lost my job, a whole load of different things. One of the people for the G app had talked me into, his name is Walter, talked me into coming to Renew and meeting people, and I came to Renew and I've never looked back.
We find when people come out of detox and things like that, and once they are starting to get involved in our service and they're starting to attend groups, their confidence is starting to grow a wee bit more, and it's then about trying to connect them into the recovery communities. The recovery communities is a really safe space for them to be, where they can go and connect with like-minded people. They can go in, be themselves, not be judged.
The year 2017, on the 24th of September, I admitted to my mum and my sister and my brother that I was an alcoholic. Drinking progressively took me to quite a dark place where I relied on it to get through day-to-day life. My 15-year career I had to give up, but I gave it up to save my life essentially. By doing that, it gave me the freedom to try and get well and get better.
Each week I was feeling more confident in myself.
To realise that I wasn't alone, the dark thoughts that I was having were similar to where everyone else was in their kind of journeys, and it was just a breath of fresh air knowing that people were going through the exact same thing as having an illness like I have, which is alcoholism.
So I came in one day and I just decided that I was going to be a volunteer. So Lou introduced me and gave me an interview, and I've never looked back to that either. It's great. Gets me up and gets me out.
And since having a bit of time to work on myself and understand why I was taking that drink more and more each day, helps me now to do my job better, which is a volunteer with North East Recovery Cafes. I'm a lead volunteer with them and the vice chair in the committee, and also halfway through a course for COSCA counselling to in turn counsel others and not be counselled for a change. So, you know, my life, I wouldn't say that I'm getting a life back. I would say that I'm starting a new life, you know.
Addiction is something that can affect anyone. It is an illness that consumes a person until they no longer recognise themselves. Key workers like Andy and Darren and the support networks available such as Renew are all there in the hopes to lend a helping hand to those in need. If you or anyone you know is experiencing difficulties with drug or alcohol abuse, help is always available. Contact someone today.